Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives.
Hello viewers, this is Dr. Syam signing in today's Doctor's Voice. Viewers, today we'll get to know about cardiology, that means heart-related problems and their advanced management from Dr. Tan Chong Hyuk. Dr. Tan Chong Hyuk, Senior Consultant, Cardiology, Mount Elizabeth Hospital, Singapore. Dr. Tan is a cardiologist practicing at Mount Elizabeth Hospital, Singapore, and has dual accreditation in interventional cardiology and echocardiography. He obtained his echocardiography training from Sydney, Australia, and he spearheaded intervention via the radial approach in Singapore. Dr. Tan has extensive experience in performing stenting of complex situations such as chronic total arterial occlusions. So, welcome Dr. Tan in SATV and to our show.
Thank you.
Okay. So, Dr. Tan, as our today's topic is cardiology, firstly, I would like to know what are the common diseases and common symptoms you encounter in your practice?
Yeah, sure. Nowadays, people have very good life. So as a result of their good living and comfortable living, they end up having a lot of narrowed arteries of the heart. So one of the major disease that I see would be coronary artery disease. That means narrowing of the heart, where people present with chest tightness when they walk fast. This is a very big group of patients. The other big group of patients will be those with high blood pressure. High blood pressure is now getting very common, and a lot of patients do not know that they have high blood pressure.
Okay. So, firstly, I would like to know high blood pressure. And what do you think, and what is your observation? What are the underlying factors for increasing the rate of high blood pressure amongst the population?
I think obesity has a huge part to play. People are now eating a lot of good food. They are also smoking, and they're very sedentary. So, of course, there's always a genetic component to it. But then you can't do anything about the genetic component. But you can do a lot about your lifestyle. So, a lot of people are eating a lot, they don't exercise, they get obese, and that's where high blood pressure as well as high cholesterol and diabetes set in.
Okay, so some of the factors are modifiable, as you were talking about body weight, and I think smoking also plays an important role.
Smoking plays a big role, particularly a coronary artery disease.
Okay, in case of high blood pressure, how important it is to keep the blood pressure under control? How important?
It is very important to lower the blood pressure. The problem with high blood pressure is that it has no symptoms, and the first symptom you may have could be your first stroke, your first heart failure, or your first kidney failure. So by lowering the blood pressure, you lower your risk of getting all these diseases. So it's vitally important to do it.
Okay, so you were talking about it's like a silent killer and present with directly with any organ failure or
correct, yes.
Damage. Then in case of young onset hypertension, and what can be the underlying causes and what do you search for?
Right. About 95% of high blood pressure has no cause whatsoever. They are called essential hypertension. Okay. So only 5% of high blood pressure would have a secondary cause, which are called secondary hypertension. Okay. Now these could include endocrinological problem where a certain hormone is secreted in excess. You may have some narrowing of the artery of the supplying the kidney, and that can cause high blood pressure. But these are not so common, as I said. So even for a young person, if a young person presents with high blood pressure, we tend to just treat it first. We would search for more underlying cause if simple therapy cannot control their high blood pressure, or they may have swinging high blood pressure or very difficult to control high blood pressure.
Okay. Now coming back to coronary artery disease, you were talking about the patients sometimes feel chest pain or chest tightness while walking or exercising. So what is the underlying mechanism of developing this kind of problem?
Sure. So all our body parts need some blood and oxygen. So when the artery supplying that part of the heart is narrowed, when you're sitting down, there may be adequate blood flow. But when you're doing something like climbing stairs, walking fast, or even running, the heart needs to pump faster and harder. And that's where not enough blood flows through, so the muscle of the heart doesn't get enough oxygen, and that's when you start feeling the pain. So that is what we call angina.
Okay. And can the coronary artery disease be asymptomatic, symptomless?
Coronary artery disease, unfortunately, can be asymptomatic or what we say no symptom. So a patient can actually have a silent heart attack. This would typically occur in somebody who is diabetic, because in diabetes the nerve endings are damaged. They don't feel pain like normal people, so you can get a small heart attack without knowing. But very often patient may just ignore their symptom when they feel a little bit of chest discomfort, a little bit of tightness, not too bad, so they ignore it and they forget about it. So and later on, when they go to see a doctor and the doctor may say, oh, you have a heart attack, then he cannot recall the event and say, no, I never had anything. Okay. So that is kind of mislabeled as asymptomatic.
Okay, so you were talking about heart attack, and can you please explain in a simpler way what is heart attack?
A heart attack occurs where the blood or the artery suddenly gets blocked. Now, when you first collect cholesterol in your artery, at the most you get some angina. You do not get heart attack. Now, the wall overlying the cholesterol, sometimes it may crack open. For example, when you're running quite fast or the heart is beating quite fast. So when the blood is flowing through the artery, it may tear the wall of the artery, thereby exposing the cholesterol underneath. So what happens then is that, like when you cut your skin and blood flows, blood naturally wants to form a clot. So in the same manner, inside the artery, when the wall of artery cracks open, a blood clot forms. And this blood clot may form quite fast and quite big and suddenly block off the whole artery. So now your artery is completely blocked suddenly and no chance for the heart to compensate. So that is a heart attack. So the patient will feel very severe chest tightness that lasts for half an hour, 1 hour or so on until he gets to hospital. He may have cold sweat, he may feel breathlessness, and this can also lead to death.
Okay, so you were talking about the presentation symptoms of heart attack. Now I would like to know, how do you manage a patient with heart attack?
Since the heart attack occurs because the artery is completely blocked, the natural thing to do is to unblock the artery. There are two ways of doing it. What we do now, most of the time, is to do what we call, well, general public call ring, or we call it stenting. So we need to get the patient to the cath lab, put a catheter in, see where the blood clot is, suck it out, and then put a stent over the area where it is originally narrowed. So this is the preferred choice because data has shown that it really lowers the risk of death in the long term as well as short term. Now, not every institution or every country has the setup to do that. So the next best thing is to give medicine to dissolve the clot. So this medicine is given through the vein and in the hope to dissolve the clot and re-establish blood flow. Unfortunately, the side effect of this, what we call clot buster medicine, is to cause bleeding elsewhere. Now, a little bit of bleeding in your leg or in the stomach may not be too bad, but it can cause severe bleeding in the brain, and that is effectively a stroke, and that's quite bad.
Okay, we will get to know more about this just after a short break. Viewers, it's time for a break. Stay with us. Viewers, welcome back to Doctor's Voice just after the break. Today we are talking about cardiology with Dr. Tan Chong Hyok, Senior Consultant, Cardiology Department, Mount Elizabeth Hospital, Singapore. Viewers, let's get back to the discussion. So we were talking about the heart attack, and you were talking that there are two approaches of treatment. One is what in general term we called ring replacement or stenting, and another is with medicine, through a medicine. So you were talking that the first priority should be to treat the patient with stenting. And is there any significant importance of time in treating the patient?
Yes. We need to open up the arteries as soon as possible. So generally, we try to get the artery open within 90 minutes of the patient stepping into the hospital. Okay. So 90 minutes from the time your foot step in the hospital to your artery open, we need to get the artery open. 90 minutes, all right? So this involves a lot of a lot of logistic. So the nurses must be well trained, the doctors in A&E must be well trained, the nurses in the cath lab must be well trained, and there must be doctors on standby. Yeah. So it's a huge logistic
support.
Yes. So, and at every stage things can go wrong. So gradually we iron out all these things that can elongate or prolong the door to balloon time. So right now we can get it down to 60 minutes or so for the artery to be open. So yes, time is critical.
Okay. And in case of heart attack patient, so every minute means muscles. Correct. For the patient.
Yes.
So before the placement of the stent, how do you see whether the arteries are blocked or not?
Right. So the first thing we need to do is get a tube to the heart. And to get a tube to the heart, obviously we need to get the tube from outside into your body. There are two places where we commonly do that. One is from the hand, the wrist, there's a radial artery here. The other one is from the femoral artery, which is at your groin. The groin artery is bigger. It's much easier to do because when you use a needle to poke into the artery, there's a bigger target. The radial artery is much smaller, so it takes a little bit more training to do that. So once we get the tube into your artery, it climbs all the way up to your heart. We inject some dye and we take a movie x-ray. So from the movie x-ray, with the dye inside the artery, we can see the artery and to determine where is the blockage.
Okay. What we call the coronary angiography.
Correct.
Yeah. So you were talking about that. Again, there are two approaches. One is through the hand and another is through femoral artery. What about the advantages and disadvantages?
Yes. So once we finish doing the procedure, we have to take everything out. And because there's a hole that we created, if we don't do anything, you will bleed to death. So we need to press over that hole. Now, the disadvantage of going into the radial artery is because it's small, but that is also this advantage. It's small and it's easy to press on it. Therefore, it's much easier to stop it from bleeding. Over the groin is a big artery. It's easy to get access to it, but that is also the disadvantage because it's a big artery and it's deeper, so it takes much more trouble to stop the bleeding. So when you're doing a femoral artery puncture, you can get bleeding risk as high as 20%, whereas over the wrist is maybe 1%.
Okay, so I think the risk is significantly reduced with radial approach.
Yes.
And regarding the stent, what about the stent? Any update in the material of a stent nowadays?
Yes. Stent has gone through a long history of development. We started off as just stainless steel. Now the material has changed to cobalt chromium. So this allows the stent strut to be thinner, and therefore it heals faster, and also it makes the stent more easy to go through tortuous artery. From there, we develop a medicine coating on the stent. So the medicine coating lowers the risk of re-narrowing of the artery after stenting. And the latest development is dissolvable stent, or we call plastic stent. The benefit of the plastic stent is that over a period of 2 years or so, the stent will dissolve. There is another type of metallic dissolvable stent which is made of magnesium. So again, this stent will dissolve over a period of 1 to 2 years. So the benefit is that after the 2 years or so, when the stents are dissolved, you have nothing in your artery. It's like you're back to a baby again.
Okay. So what about the complications during stenting?
Yeah, during stenting, depending on what type of narrowing you're dealing with, in the case of heart attack, because we're dealing with clot that is freshly formed, it's very soft, it's very easy to do stenting. And if you're not dealing with heart attack, you're dealing with stable coronary artery disease, it means that you're dealing with cholesterol that's been collecting there. Now, when you collect cholesterol, over time calcium comes in, and it makes that narrowing very hard. It can be as hard as a rock where a balloon will not open it, and we need things like drilling. So therefore it depends on what kind of narrowing we're dealing with. Simple narrowing like heart attack, the risk is generally quite low as long as you can suck up all the clot, open the stent properly. very low risk. Simple narrowing, again, quite low risk. Once you get onto more complicated narrowing, such as chronic total occlusion or very heavily calcified occlusion or left main occlusion, it becomes difficult. So when things become difficult, more complication can occur. For example, not able to open the artery, or we can cause perforation of artery, or we can cause tearing of the artery. Now, fortunately, stenting has a very long history. It's now almost 30, 40 years. So the technique has improved a lot. The equipment has improved a lot. So we hardly ever get into big problem where we need the surgeon to come and help us out. So even simple complication, we are able to overcome and treat it.
Okay, and before going to other topics, I would like to hear from you that in some cases of heart attack patients, some of the doctors suggest to go for surgery, and in some cases you offer to undergo stenting. How do you decide actually?
Generally, patients now prefer stenting. And as I said, the technique has improved, the equipment has improved. So a lot of these cases can have a stent put in. There are cases where the disease is very complicated, like more than 3 or 4 arteries blocked. Then maybe the cost of stenting can be very high. The number of stents needed may be many. And in such cases, we may say, okay, would you like to consider bypass? But in the case of heart attack, we seldom need to send patient for bypass on presentation. Because as I said, the narrowing is usually soft. The blockage is soft because it's a clot. So we can at least open up the clot first. Now, if the patient presenting with heart attack has also, at the same time, many different arteries blocked, after opening up that one artery, we may say, look, would you want to consider bypass? But as I said, generally, a lot of patients can undergo stenting.
Okay, so we will get to know more about this just after a short break. Viewers, it's time for a break. Stay with us. Hello viewers, welcome to Doctor's Voice. Today we are talking about cardiology with Dr. Tan Chong Hyuk, Senior Consultant, Cardiology, Mount Elizabeth Hospital, Singapore. Viewers, let's get back to the discussion. So we were talking about the management options following heart attack, and now I would like to know what about the post-stent management, post-stenting management, how do you offer?
Well, once the artery is open, the patient should be back to normal. After that, in the very short term, really we're talking about the puncture site. So if we are talking about radial puncture, what happens is the patient goes to the ward with a pressure bandage. You'll stay there for a few hours, usually about 3 to 4, and then we remove the bandage. If there's no bleeding, in the case of stenting, we keep them overnight just to observe them. And then usually they're discharged the next day. Following that, they need to take medicine. It's very, very important that they do not miss out on medicine. Now, the stent is a material. It's a foreign body. So your blood would have tendency to form clot within the stent. So your doctor would have to give you 2 types of medicine to, well, we call thin the blood, but your blood doesn't really get thin. It's just that it doesn't form clots so easily, so that you don't get clot inside the stent. So it's important that you take these 2 medicine for at least 1 year. That's the current guideline. After 1 year, you can stop one of them, okay? But you always need to take at least 1 thinner for the rest of your life. And of course, there is the issue of lifestyle management. Now, why did you have a heart attack? Was it because you were smoking? So first thing to do is stop smoking. Now, if you've not been doing much exercise, maybe it's time you start an exercise program. Watch your diet. Now, because the cholesterol is the one that's causing the narrowing, you naturally need to take medicine to control your cholesterol. Not just to prevent the re-narrowing inside the stent, but to prevent new narrowings in your other arteries as well. So basically, lifestyle management, exercise, stop smoking, and make sure you take your medicine. After that, you really need to go back to see your doctor on a regular basis, because you either can develop new narrowing or the stent may reblock. So we need to keep an eye on that.
Okay. So just before switching the topic to another one, I would like to know how do you manage in terms of in cases of where the arteries are completely blocked for a long time? Can you manage that with stenting?
Yes. An artery that's completely blocked for a very long time is what we call chronic total occlusion. Chronic means a long term. Total, of course, completely. Occlusion means blocked. So an artery that's completely blocked for a very long time. These narrowings or these blockages are much more difficult to stent compared to an artery that's blocked maybe up to 90-95%. The reason for that is that, as I said earlier, the narrowing becomes very hard. So to do stenting, what we need to do first of all is to put a wire across the narrowing, the narrow part of the artery, and the balloon follows the wire down. Now, in chronic total occlusion, or we say CTO for short, the wire is not able to cross that narrowing because it's very hard, because you don't know the path of the artery, because there's an area where you can think of it as no road.
Okay.
All right, the road is gone. So how does the path go? You don't know. So these makes technically very challenging. Okay, but with improved technique and improved equipment, a lot of these patients can undergo stenting.
Okay. What about the complications and success rate in this case, in these complicated cases?
Right. Now, the success rate, unfortunately, in most cardiologists' hands who are not trained in doing chronic total occlusion, maybe about 50%. Somebody who has done some experience in chronic total occlusion can maybe get up to 65-70%. Now, there is a special technique in treating chronic total occlusion that is called retrograde approach. Now, let me explain a little bit about this. So as your artery slowly narrows in one side, let's say the left artery slowly narrows. Now, as it narrows and it approaches complete blockage, surprisingly, you don't get a heart attack. That is because on the right artery, small connecting vessels will open up. These are called collateral. So it's almost like when one of your highways is blocked, people tend to take the opposite highway and connect through the other end of the highway. So these little connecting channels or collateral will supply the area that is blocked on the left side. Now, because they are small connecting channels, we can make use of these small connecting channels. So whereas normally you will put a wire down from the top down, now you go to the opposite artery, the one that is not blocked. Okay, you put the wire down the normal artery, climb up these very fine collateral, and then go back up and join the blocked artery at the top. So in this way, because it's coming up from the bottom up, we call it retrograde approach. Okay, so it is a retrograde approach, and this is a very technically challenging approach. Now, if a doctor has good experience in doing retrograde approach, he can actually achieve a success rate anywhere from 85 to 90%.
Oh, that's quite high.
That's very high compared to 50%.
Yeah.
And unfortunately, the worst thing is that up to 70% of chronic total occlusion patients, because it's difficult, the doctor doesn't even try. So only a small proportion of patients will have their cardiologist attempting a completely blocked artery.
Okay. So, Dr. Tan, we're at the end of our show. Lastly, I would like to know what is your advice for our viewers, how they can stay healthy and stay away from heart diseases?
Yes. Well, since coming to Bangladesh, I've tasted some of your delicious food. And actually, anything that tastes good will have high cholesterol, high fat. Okay, so with your food being so delicious, I think a lot of your viewers would have problem controlling their eating habit. So when you do that, you tend to get obese. And our very busy schedule, you also don't exercise. So again, it comes back to the whole issue of lifestyle, obesity, sedentary lifestyle. Okay, that leads to high blood pressure, diabetes, and also collection of cholesterol in your artery. So My advice to everyone is that if you smoke, stop smoking, please. Even though if you're continuing smoking will give me a lot of business, but I'd rather you stay healthy. Okay, so please stop smoking. Start a regular exercise program. You can do something simple, like just going for a brisk walk, half an hour, 3 to 4 times a week. That is a massive improvement from doing nothing. And please control eating. Avoid obesity.
Thank you, Dr. Tan. I think the viewers will be enlightened by our show. And lastly, I wish you have a safe journey back home to Singapore.
Thank you very much for inviting me here.
It's our pleasure. Viewers, that's all for today. Hope to see you on next episode. Till then, stay fine, stay tuned.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital will put Singapore on the world map. We've invested in the state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital, which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows, and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex and difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. You have the best of the best working in this hospital.
The clinics are actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times. enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile. That's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and, of course, selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products. But it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.